All right, we're recording. Hi, everyone. Thanks for joining us today. I'm here with Regina Schoenberger for our Lyme Disease Month Awareness Health Series. Regina is our community educator, and she's going to be here talking today about how we can treat Lyme with a more natural and plant-based approach. So, Regina, thank you so much for being here today. I'm going to start with our first question. What is your experience with Lyme disease and cannabis?
Thank you for having me, Krista. Really excited to be here.
Of course.
We're in the kickoff season of this vector-borne bacterial disease, Lyme disease. I've worked in the cannabis space for the past 5 years, and there's been countless patients that have come through the program that have had chronic Lyme disease for a long time, and conventional medicine has failed them, and they're looking for more of a natural alternative. So I'm not a clinician myself, but I am under the guidance of Dr. Vincent Leonti, medical director of Princeton Integrative Health, and just want to say cannabis is in no way a cure for Lyme disease, but it can definitely help manage a lot of the symptoms that are associated with chronic Lyme, like of course, there's pain, numbing, tingling, the rampant inflammation that is set off in the body. Neurological issues can happen when you have chronic Lyme, maybe like the drooping face, seizures, fatigue, lack of sleep. So cannabis, there's different components in the plant that can target these issues. And what's really interesting is that Lyme, I'm not sure if you know this, it's one of the most under-researched diseases, but it's diagnosed more than HIV and breast cancer in the United States right now.
Wow.
So definitely running rampant.
Yeah, we talked a little bit about that yesterday with Jenna, who kind of gave us a brief overview of, her experience with Lyme as well. But yeah, it's been around for a long time, yet it's still so prevalent, and so many people don't realize how prevalent it is. So it's so important to emphasize that. Can you tell us, is cannabis effective in combating the side effects? I mean, I know you just went a little bit into that, but can you elaborate a little bit?
Absolutely. So, as I mentioned before, I've worked with countless patients that do have chronic Lyme, and the common protocol is to, do a series of antibiotics that you're on for a long time. And we know that antibiotics have worked for some people, but for some they are notorious for causing a host of other negative side effects and damaging side effects on our systems. But cannabis can be an effective treatment because it can help modulate a lot of these symptoms. When you look specifically at the plant, there's hundreds of cannabinoids, which are the fatty medicinal molecules in the plant. And there's 3 prominent cannabinoids that can target these symptoms. So THC, CBD, and CBG. When you look at THC, it has a special relationship with the central nervous system. So if you are someone that's experiencing nerve issues, neurological issues as a side effect of cannabis, THC component can help. CBD is an anti-inflammatory powerhouse. It can help target the inflammation that patients are experiencing from Lyme disease. It also can help with sleep. So a lot of patients, they're fatigued all throughout the day. They're having sleep issues. We know sleep is the foundation of health, where your brain has the opportunity to clean itself. But CBD, it actually interacts with a naturally occurring amino acid GABA, which is involved in our deep sleep cycle. So that's how CBD can help some of these symptoms. And then there's cannabidiol, CBG, which is also anti-inflammatory, and it also contains antibacterial properties, which shows promise as well, because this is a bacterial vector-borne infection.
Wow.
I just want to also mention that the endocannabinoid system, I'm
getting a weird echo. I'm sorry.
That's okay. Can you hear me okay? I can hear you perfectly. Is that better?
Yeah, my earbuds just went from my computer to my phone, and I'm not sure where it's connected at this point.
Can you hear me? Should I keep going?
Hold on one second. I'm so sorry. All right.
Just while Krista's fixing her headphones, just to reiterate, cannabis can help modulate
I'm
symptoms,
just going to take these off.
pain, of numbing, tingling. It can target inflammation, help seizures, fatigue, sleep.
Okay, I can hear you again. I'm so sorry.
Oh, perfect. Okay. No worries.
AirPods were like going back and forth between my phone and my computer, so I apologize for that. There's always some sort of technical difficulty on Zoom, I guess.
No problem.
So, did you go over any of the recommendations to a patient who may suspect that they have Lyme disease?
Absolutely. And just to finish up the last thought, specifically, how does cannabis help? We all contain an endocannabinoid system, which is a system of biological processes that every living being with a vertebrae contains. And when we consume cannabis, we're engaging this system.
Mm-hmm.
The ECS, it interacts with the central and peripheral nervous system, the gut-brain connection, and it helps modulate the immune system. So those are examples of how cannabis can really help and target some of these symptoms of Lyme disease. But if you are someone that suspects that you have Lyme, chronic Lyme, I can't recommend enough getting tested. Reach out to Princeton Integrative Health. We offer free discovery sessions. PIH offers 4 different vector-borne lab testing that you can learn more about. And why would you go to PIH versus going to, your conventional doctor? Well, these specific tests have a higher sensitivity and specificity than the 2-tier testing by CDC criteria, demonstrated by internal studies. So one of the labs I really love that we use is called Vibrant. So if you do suspect that you have Lyme disease, definitely get tested. And we work with 4 different labs that offer robust testing.
Absolutely. And that was another thing that Jenna touched upon yesterday, is that you may have different symptoms that no one has tested you for Lyme for, because they're not, generally Lyme associated, but they could be from a bite that was, years ago that just never got detected. So it's so important to come in, kind of assess the situation, and if it is in fact Lyme, begin that treatment process immediately, because it has long-term effects.
Absolutely. Yeah, I can't agree with you more. And a lot of people, it goes undiagnosed or misdiagnosed because a lot of the symptoms mimic other issues, like arthritis and fibromyalgia.
And even now with COVID, there's some of the similar, symptoms too that we talked about a little bit yesterday too. So it's so important, prevention, and then of course treatment when, when you finally get that diagnosis.
Yeah.
I would love to open it up for questions. If anyone has any, please feel free to write them in the chat or unmute yourself if you're on here with us on Zoom. But if there's anything else you want to kind of include too, while we're waiting for any questions.
Yeah, so just to drive home, how does cannabis help with Lyme? You want to look at the components of the plant. THC is going to target the central nervous system. CBD is that anti-inflammatory powerhouse that also helps with sleep. And then CBG has that antibacterial component. So when you look at the different components of cannabis, not to say that's going to cure Lyme, but it's definitely going to be an effective tool in your arsenal against these symptoms. And also interesting fact that, so cannabis has terpenes, right? They're the essential oils of the cannabis plant. And if you look at or smell strains that have a lemon flavor to them, those strains are going to be packed with limonene, and limonene also has that antibacterial component to it as well. So yeah, cannabis is definitely a fascinating plant that offers therapeutic benefit and can combat the symptoms of Lyme. And then one other thing I wanted to touch base on, if you're looking for some great reading material, I can't recommend enough the book by Shelley White. It is called Cannabis for Lyme Disease and Related Conditions. So she's not a doctor, but she's compiled scientific evidence as well as her own anecdotal evidence because she's a patient that has had Lyme disease and conventional medicine has failed her. So she kind of goes over a more natural protocol and how she used cannabis to combat Lyme. So it's a book by Shelley White.
Great.
You can get that on Amazon.
Thank you so much, Regina. We do have a question on Facebook. Question is, if a person likely were bitten many years ago, would any Lyme test be better to take to see if there is still a problem that could be treated?
Absolutely. And I believe, that's the main issue, how Lyme can go undetected and run rampant and can become chronic, even if you were bitten years ago. So I definitely, I'm not a clinician, and I know Jenna can speak to the testing better as well as Dr. Vinny, but I absolutely recommend, reaching out to us, learning more about the different tests that are available that we offer.
Right. So I think, regardless of what a test that we would give you, they're probably going to pick it up better than if you did a more conventional test through LabCorp or something like that.
Yeah, absolutely. And because it has that higher sensitivity and specificity. Go on to vibrantlabs.com. They have great information on their testing. So pretty informative.
So yeah, Vibrant Labs, definitely one of those that would be a recommendation, but others obviously could be better for you too. All right, well, I think that's all we have. Again, thank you so much, Regina, for joining us today. You've given us, again, so much information, and we really appreciate your expertise. Like I said, from when we started the meeting, this is Lyme Disease Awareness Month, all of May, so we'll be having more of these events throughout the month. Next week, on Thursday at 4:30, I'll be speaking with Dr. Vin about Lyme disease and how it affects our brain and our cognitive function. And then the following week on May 26th at noon, I will be speaking with Joe Bonacci, our acupuncturist and functional medicine practitioner, about how an integrative approach to treating Lyme disease can really help with those symptoms. Obviously, cannabis is one of those, but there's other modalities that can also help. So be sure to join us. You can find those events on our Facebook page and our website. And again, like Regina said, if you have any of these symptoms or have any issues related to Lyme disease or possibly unrelated that may be Lyme related, please give us a call at 609-512-1468. And you can schedule a discovery session with one of our practitioners to get all your questions answered. And you can go from there to treating those symptoms. So thank you again for joining us, and I hope to see you soon.
Thanks, Krista. Thank you.
Bye. See you soon.